Absolutely. There was a question here about ostomies, ileostomies. Any increased risk in those patients?
Yeah. So if you have an ileostomy, so that's essentially your small bowel coming out into your abdomen and then your contents going into a bag, there is no increased risk of just having an ostomy in terms of contracting COVID or in terms of having bad outcomes. Where the risk potentially happens if you have an ostomy is in relationship to disease activity. So if you have active inflammation in your small bowel, just like if you had active inflammation and you didn't have an ostomy, your risk would be higher. And people with ostomy sometimes have a higher propensity to get dehydrated because they don't have their colon to kind of suck up the water. And so they sometimes, when they get a flare, they can sometimes get dehydrated, run into kidney problems, sometimes need to be supported in hospital. So it's not so much that the virus itself would necessarily cause greater harm from ostomy, it's just that you have to have greater care for your health system. And similarly, when I was talking earlier about that short gut syndrome, if you have an ostomy and you've had multiple surgeries and you've lost a lot of your small bowel, your susceptibility, whether it's to a flare or if you have even just a gastrointestinal illness or whatever cause of an infection, is going to be higher in those scenarios.